Ending days of speculation about the status of the pandemic, the World Health Organization today announcing COVID-19 continues to be a public health emergency of international concern. The head of the UN Health Agency announcing that he agrees with the decision coming from the International Health Regulations Emergency Committee. That committee determined COVID-19 is probably at a transition point, but it remains a dangerous infectious disease with the capacity to cause substantial damage to health and health systems.
Since the beginning of December, weekly reported deaths have been rising. In the past 8 weeks, more than 170,000 people have lost their lives to COVID-19. And that's just the reported deaths. We know the actual number is much higher.
The WHO also expressed concern about the continued evolution of the virus and a substantial decrease in the reporting of data on the pandemic by member states. With me now to discuss is infectious disease specialist Dr. Isaac Bogoch. Good morning to you, Dr. Bogoch. Boy, we have been waiting days for this decision. It's finally out there in public. This emergency declaration will stay in place. Is this what you were expecting? Let's start with getting your reaction.
In all fairness, I wasn't sure which way they were going to go. And I think the key point here is that this will be lifted. This will, at some point, be it weeks or months down the line, the WHO will say this no longer meets criteria for a public health emergency of international concern, and this will be lifted. And I like the way they expressed this today. There still are issues that need attention. And that, of course, includes the virus continuing to impact health and health systems around the world, the need for more data sharing, the need for ensuring that the most at-risk individuals still have access to vaccinations and, of course, therapeutics. So there's still a lot that needs to be done on a global level. And for these reasons, and a few others, they decided to keep that designation. But it will be lifted at some point. They also commented, too, that COVID's not going anywhere. This is going to be around for a long, long, long time. And even when the designation is lifted, we still have to take care of ourselves and ensure that we protect individuals from this pathogen.
So in this country, does this declaration change the way we approach the virus?
Absolutely not. And in fact, Dr. Theresa Tam, Canada's Chief Public Health Officer, stated this as such about a week ago, and we're gonna stay the course. We still take it seriously. We still have vaccines and therapeutics. We still are sharing our data nationally and internationally. And of course, I'm not saying this is a perfect plan. There certainly are elements for improvement in our national and subnational approach to COVID-19, but it will not impact what we do here in Canada.
Let's dig a little bit deeper as to why this decision was made. What do you think is the threshold that needs to be met globally for the World Health Organization to deem this that it's not an emergency anymore?
I think it's going to take time, and I'm not entirely sure, because if you look, let's just say 4 months or 6 months down the line, is the world going to look that much different, right? They're talking about the continued virus evolution. Well, that's what this virus is going to do on an indefinite basis. They talked about unchecked circulation of the virus. Well, that's not going to change. They talked about fewer member states reporting data. Sadly, that's the state of affairs where we're at right now. And we certainly need greater transparency among member states to share the data. But I don't see that actually changing at any time over the next 4 to 6 months. So I think they'll just quietly lift this at some point, 4 to 6 months down the line. But I actually don't think we'll be in any different place than where we're at right now.
Dr. Bogoch, thank you so much. Dr. Isaac Bogoch is an infectious disease specialist.